What we're encouraging people to do is to think very much more creatively around what constitutes an asset and how it could be applied to better service delivery. So individuals' time is an asset, cognisance and intellect are an asset, thinking about people who use services and whether they're able to better provide for themselves if they're given better information and more appropriate information. Thinking about communities as a whole as an asset in terms of devising service solutions and helping to deliver them. So we would say don't look just at your budget lines and at your buildings and your estate as your assets. Think a lot more creatively and laterally around what can be brought into the mix and how can you deliver better services with a much broader range of resources. I think there's a couple of areas of service that we've alluded to in the article which lend themselves to being utilised in a broader range of healthcare settings. I think the use of the single assessment approach is definitely one that enables you to ensure that the right services are delivered to the right people at the right time and that the right level of expertise is applied to addressing specific needs. But the other one for us is the programme where we train and equip service users, family members and carers to become almost semi-professional within the home environment. So by doing that, we're effectively able to increase the level of support from, an hour's session once a fortnight to almost 24/7 provision, because people within the home environment are now able to have very structured conversations. They understand how to talk in a motivating way to enhance treatment and therapy. And in a sense, it offers a huge additional resource to what can only be provided in a limited way in specialist services. So we would look at other chronic health conditions where you have family members and carers who, given the right information and training, would be able to support the clinical interventions that are being provided by the health service and effectively enhance the outcomes and reduce the need for dependence on specialist provision. Successful prudent healthcare will look very different to the way that we've traditionally thought about the provision of not just healthcare but public sector services in general. For me, there's something very much about shared ownership. So the idea of providing people with a public service need with the ability to contribute to addressing that need. So providing services with people rather than having those services done to them. It would very much look at a broader spectrum of assets rather than just the traditional look at, staffing, finance and buildings, and think more creatively around some of the community assets, the time that volunteers can offer, the expertise that we may have within the communities that can help contribute to the delivery of services. And ultimately, I think prudent healthcare will foster a shared ownership at a community level. So individuals who have a public service need or a healthcare need feel empowered and able to make an active contribution to addressing that need, and they're supported too by professionals who understand the role that individuals can play in their own treatment, healthcare and support.